Welcome to week 37. This is the week you have been waiting for. Your baby's lungs are officially developed and are ready to breathe on their own. Your baby's first breath of oxygen, which usually accompanies their first sweet cry into the world, will bring you great joy as the beautiful sound of new life radiates throughout the delivery room. Your little one is on average between 6 and 7 pounds now, and around 19 inches in length approximately. Your unique little baby will enter the world anytime now with 300 bones that will begin to fuse together after the journey through the birth canal. After birth, those 300 bones will harden and come together slowly. They will number 206 within just a matter of months. That sweet child will not be cramped for long or breathing in the sterile waters of the amniotic fluid while eating through the umbilical cord. The digestion system is ready and will be jump-started at the first drink on the outside to produce their first full diaper. Though, in this pending state, everything will continue as baby knows until they see that first light. Most of what was on the inside of the womb will change for their life on earth. Eating, breathing, feeling snug and perfectly cushioned will all be in the past now, as your time of trial ends with the labor that you have been actively preparing for many weeks now. At some point, the Braxton Hicks contractions that you believed were quite painful at times will develop into rhythmic contractions that slowly will move closer together and become evenly spaced and stronger at about 5 minutes apart, or your water will break. Whichever method happens to you, this will be your signal that it is time to make a call to the hospital, birthing center, or home delivery midwife. Once you reach the place you will deliver, your trusted delivery person will then check to see how far you have dilated. This is not comfortable during contractions, but to date, it is the only way the provider can see how far you have progressed in labor. Even though you may value your privacy and have kept your body private, now is the time and here will be the day that your body will be the center of everyone in the room's attention, which will enlighten you to how dependent we are as a society to those around us in the world, for life is not designed for dependence on ourselves alone. You can request a female midwife, nurse, or doctor, but chances are whoever is on call at the time of labor is who will be in the room, helping you get into the proper mind frame and position to help your baby enter into the world. Labor can last between a few hours and up to a few days, depending on what type of interventions you choose. Most first births will be the longest that you will have because the body is just learning what it must do. There are 3 stages of labor that must happen to dilate the cervix to be at the 10 centimeter mark where you can begin to push. The first stage is the dilation of the cervix and the effacement of the uterus. All this means is the cervix becomes thinner rather than thick to protect baby like it has throughout development. The second stage is the time for pushing and delivery, and the third is the delivery of the placenta. So let's begin by thinking of only the first stage, because this will happen first and will be the longest in duration. As your baby's head has begun pushing in their head down position on the cervix during these last few weeks, it has caused it to thin or efface. Your cervix that was high and in position, approximately back by your spine, and 3 to 4 centimeters long and thick will move. As labor progresses, the cervical opening must move down towards your vagina and will thin up to 100%. So, to be ready for the second stage of labor, you will be 100% effaced and 10 centimeters dilated. The combination of the two will allow you to enter into the pushing stage. Now, this stage can be shorter if you know what you are doing, and that will only happen by trial or by possibly hearing of what to do. The movies and older educational classes show the classic breathing technique of labor as the but it is honestly overrated. The best thing to think of is what is called bearing down. Now, this term is not easy to know exactly what to do when thinking of labor, but the process is similar to what you have naturally learned to do your entire life in the bathroom. In order to push, you must use all the muscles in your bottom to hone in and push with all of your energy to target those muscles and push like you have to go to the bathroom. Many midwives will suggest that you sit on the toilet during contractions before the pushing stage because this can help your body naturally understand how to move baby down. Deep meditative breathing will help you use your lungs and will get you further and closer to what you ultimately want to achieve during labor, which is pushing with the crowning of baby's head. This is the time that movies have portrayed a horrible side to a woman, yelling out angry words and saying they will never do this again. But I assure you, you can serenely deliver with minimal yelling out and pain by using all the techniques spoken about over this past pregnancy series that have developed your mind into the kind and humble lady that is about to meet her baby. The crowning will be the most painful point of the pushing stage, for it is at this point that your body will be stretched to the furthest to allow the head to come through to where it is described as a crown resting on the head. This is what my first midwife called the ring of fire, and it is a very good comparison. Listen to the person delivering your baby, and if they say to stop pushing, do your absolute best to stop pushing because they have eyes on your little one. They may need time to help maneuver your baby to get your baby into the easiest position to deliver. The goal is to push only through the contractions and give your body a rest when the contractions subside. But during this intense time, you may feel you want to push regardless. Yes, the pain is there, but you can do it with prayer and meditation and support from your spouse or doula, the team of nurses, the midwife or doctor on staff. The pain can be managed naturally and without screaming, but if you feel you just cannot do it, there are many options that you may want to consider before contractions start. There are times for each medication to be given, and some, if you do not take by a certain point, they cannot be used. The most well-known method is the epidural that is given when the body is just starting to dilate, but it can be given up until the pushing stage. You must stay still during the process of the anesthesiologist injecting the medication into your spine, and this may be quite difficult to time precisely given the speed at which your contractions are developing and the availability of the anesthesiologist. This is why many hospitals recommend that you receive this earlier in the first stage of labor. This medication works slower also and does not provide an immediate effect because it is injected into your cerebral spinal fluid, which is contained in pockets surrounding your spinal cord. The medication will be precisely injected in the cavity of liquid and will allow you to not feel the pain of labor, but allow labor to progress so you can move your legs. A spinal, on the other hand, is administered in the same way by an anesthesiologist into the cerebral spinal fluid, but it is used more for emergency C-sections and situations, which we will discuss more next week. It can also be given during labor, but it will numb your legs from the waist down, which will make it quite interesting when you are told to push, because you will not be able to feel to push. These two methods are used by many women to give birth to their sweet babies. The other methods are ones that you can get without an anesthesiologist. The first is called Pitocin, and it is given through your IV that will already be in place in your arm for delivery. This medication slowly drips down into your vein and will help progress the contractions and will not allow your body to stall or stop contractions once they have started. Without this medication, labor can start and stop, and this type of labor is the type you hear about that lasts for days because contractions can stall and not be strong enough for some women to produce rhythmic contractions to fully dilate the cervix. Pitocin may not be an option in some labors where there is a risk of rupture of the uterus or hemorrhage, but it is a relatively safe option for speeding along the process with a synthetic oxytocin that is already going to be present in your body in its natural form for delivery. The last common option is nitrous oxide, and this is a medication that is given in an oxygen mask that you breathe in, that you are probably more familiar with in dental procedures. It can be used during the pushing stage to relax a stressed or scared mother, but must be used in moderation. It can be something that is a last resort to a woman who has stated that they want a natural birth, but then may feel it's too intense at the time during the pushing stage or labor. Many hospitals do have this medication, and you can discuss this at your appointment if you have not heard it mentioned. There are also many other pain medications or other medications to speed along delivery or help it begin. But these are the big four that many women choose. The choice will be yours and will be personal based on your own delivery goals. The purpose of labor and delivery is to bring your child into the world, and the focus of the laboring process should be just that. Minimalizing it and wanting to avoid all pain takes away from the miraculous process that God intended it to be. Yes, God did design it to not be a painful process, but as a consequence of the fall of man, we as women are subject to a painful birth. But that does not downplay the beauty of the process. Maternity is a beautiful process, but most women that are pregnant do not view themselves as the beautiful glorification of a created woman doing exactly as Christ intended, sacrificing themselves to their most dependent state, where they are, as has been stated in certain biblical translations, as heavy with child. A woman in her last month is in no state to defend herself and really do anything without compassionate assistance. We are reliant on those around us to support us, and if we push ourselves too much, we could bring upon an early delivery, undue pain to our child, or demise to both mother and child. This is a time that we must center ourselves and give ourselves over to the charity of others whom wish to support us. We are, in essence, giving our beauty, our life, our love over to our child as we fully rely on our husband and family to support us. We are going to be at their mercy during the next few days or weeks as our body begins to move slower. We will need more support and rest than we have ever felt we have needed in the past. This time of trial is not meant to be a time of isolation, but for many women, it will be, and it is in those times that the biblical verses can sound off as a repeated hymn in our mind about how the pregnant women will be significantly tried. We give of ourselves greatly now, and we will continue to do so as birth leads us into a new portion of our lives where we will have to choose again how to fully love in our new time of holding our precious child. As the maternity period ends with the birth of our baby, we will also end part of ourselves as we will transform into the loving and sacrificial mother that our child longs for. The choice will be ours as to what we are willing to give to this new life. This new love demands great things of us and will be a lifelong process of choosing to put our child's needs before our own. As we ponder these thoughts, it can be very valuable to use these last days to meditate upon what type of mother you truly want to be for your child. What will you value? Monetary giving and the things of this world, or a selfless, life-giving devotion of your body for love of your child? Everything comes down to this question, because it will be based off of these decisions that your unique love will take root for your family. In order to truly understand love and charity at a far greater level than interpreting it ourselves, I would like to read you number 268 of the Divine Intimacy on Charity, and how charity or love is not selfish. Since so many of us have been fed the lie that making yourself happy will lead a person to truly experience happiness, I feel this is so important to truly understand love and happiness that God wishes us to give to others. I believe these following words can be perfectly applied to the love that we will be called to give to our child or children, where it speaks of love for our neighbor, because our child will be our closest neighbor within our own household, and by supporting this child in love will be your greatest task for your role as a mother. This is number 268 on page 804, which on the old calendar of the church, which was in effect before Vatican II, was the 11th week after Pentecost. If you would like more reading on love and responsibility that love carries, you can look into the book Love and Responsibility by Pope St. John Paul II, which radically changed my entire viewpoint on life. This is titled Charity is Not Selfish. O God, who has loved me from all eternity and always lovest me in a disinterested way, teach me to love without calculation or measure. And there are 3 parts to this, and the first part is a meditation. Charity seeketh not her own. This is in 1 Corinthians chapter 13, verse 5. Attention to the needs and sorrows of others with a constant readiness to give one's help is no justification for expecting a like return. Do good and lend, hoping for nothing thereby, and your reward shall be great, and you shall be the sons of the highest, for he is kind to the unthankful and to the evil. That is in Luke chapter 6, verse 35. Charity does not give in order to receive. It gives without counting the cost and without measure, for it knows that the honor of serving and loving God in his creatures is ample reward. Charity loves, serves, gives, and spends itself lavishly, solely for the sake of loving and serving God and others, for the joy of imitating his infinite generosity, for the joy of feeling itself the child of the Heavenly Father, who bestows his favors upon all without distinction. What greater reward can there be than to be able to call ourselves, and to be in all truth, children of God? To enjoy this reward, charity seeks to fly from every earthly recompense and hides the good it does. Let not thy left hand know what thy right hand does. That's in Matthew chapter 6, verse 3. It seeks by preference to benefit from those whom it can expect nothing in return. When thou makest a dinner or a supper, call not thy friends nor thy brethren, lest perhaps they also invite thee, and a recompense be made to thee. But when thou makest a feast, call the poor, the maimed, the lame, and the blind, and thou shalt be blessed, because they have not wherewith to make thee recompense. That's in Luke chapter 14, verse 12 to 14. How the logic of the gospel differs from the logic of human calculations. Whenever a strong desire to give ourselves to God arises in our heart, it is accompanied by a similar longing to give ourselves to others solely for the love of God. Then we no longer distinguish between serving God and serving others. We see God in everyone. We give ourselves to them in order to give ourselves to God, and we give ourselves to all as we would give ourselves to God. This was the attitude in the heart of St. Paul when he exclaimed, "But I most gladly will spend and be spent myself for your souls, although loving you more, I be loved less." That was in 2 Corinthians 12, verse 12 and 15. And this is the meditation number 2. Charity is patient, is kind, and is not provoked to anger. That is in 1 Corinthians chapter 13, verse 4 to 5. Charity is never wearied, is never impatient with the ungrateful, is not irritated when repulsed, but perseveres in loving and doing good. Charity does not look for gratitude. It is not ungracious. It is not offended when it meets with a lack of refinement or consideration. But in spite of the coldness and hostility which it may encounter, it continues its one work, to give itself, and to give itself always for the love of God. At the same time, however, charity is not insensible to ingratitude and offenses. On the contrary, the more a heart is refined in love, the more sensitive it is to everything which is opposed to love. But it does not make use of its sensitiveness to defend its own rights, to protest against the ingratitude of others, or to demand some degree of justice. It sacrifices all these to God for the benefit of those who have caused its suffering. This is the characteristic of charity. It does not permit itself to be overcome by evil, but it overcomes evil by good. That is Romans chapter 12, verse 21. We all know, however, how difficult this is, how hard for selfish, demanding nature. Sometimes, just when one is about to perform an especially delicate act of charity for another, a strong feeling of antipathy towards that person arises from the sensitive part of the soul because of the absence of some sign or token of respect or consideration. This is manifestly a temptation which must be overcome as soon as it appears, that it may not take root. Anyone who would yield to these feelings and act accordingly under the pretext of justice or of teaching a lesson would soon become very exacting, to the great detriment of charity. In community life especially, patient charity must be practiced. The charity which knows how to pass over wrongs, little or great, misunderstandings and offenses, one which knows how to accept calmly every pinprick without even appearing to feel it or trying to show others that they have hurt us. With the help of God's grace, and by struggling against the resentments of self-love, we shall attain to that charity which is completely forgetful of self. Then we shall be good to those around us, not justices of the peace, but angels of peace. May you have a wonderful week, my friend.